I'm here with my coworker, Erin Lee, who is a medical assistant in neurology and physical medicine and rehabilitation, physiology, and I just learned has a bit of an experience in anesthesia as well. So, Erin, do you mind talking a little bit about what experience has most shaped your view?
Of course, thank you for having me. Probably what shaped maybe my experience the most is working in pain management at a pain management clinic that was very, very busy.
And what did you do there?
I was a medical assistant and X-ray tech, so assisted with procedures. Also did clinical intake and triage. The clinic did a great deal of spinal injections, but also prescribed opioids. Sort of the deal that was had, if you want to call it that, is that the physician would not prescribe opioids unless the patients were open to having injections. On the one hand, I felt like sometimes our clinic treated patients who had been on long-term opioids somewhat harshly or unfairly,
stigmatized,
especially if they were seeking high levels of opioids. Although it was certainly not these patients' fault that they were accustomed to high levels of opioids. They had been placed on them legitimately and often found a great difficulty of continuing the levels that they were on, which led to withdrawal and a great deal of distress. I think over time, the trends tended to change towards prescribing less opioids, especially after the CDC produced some guidelines in 2016 about opioid prescribing. And that just led to a lot of patients being, I think, unfairly placed in a really unfortunate position of not being able to obtain the medications that they needed.
Do you think the perspective of the patients in the doctor's eyes changed at all over time? Like, where once they had gone from like a quote success story to suddenly they're a needy patient or a drug seeker?
Sure, absolutely. I do think it changed over time, where the same level of opioids that a patient might be taking would suddenly be perceived as being too much or excessive, and patients only seeking to continue that might be stigmatized or looked at as drug seekers or addicts. I think even physicians that I encountered did look at patients in that way, and maybe that wasn't entirely fair, but nonetheless.
What do you think is the most harmful potential effect of these medications?
For example, if a patient, due to changing prescribing guidelines, etc., they sometimes turn to street sources of opioids, and that is where a great deal of danger comes in, because of potentially contaminants like fentanyl being found in street drugs like heroin that a patient might use as a substitute for the previously prescribed opioids.
Yeah.
And obviously that can lead to unintentional overdose.
What is the most important or influential or effective form in your eyes of media to reshape public opinion on drugs?
I actually recently finished a book on Purdue Pharma and the Sackler family. It's actually called Empire Pain. They started aggressively trying to remove inhibitions that doctors had about prescribing opioids with their aggressive marketing campaign. They knew at the time that opioids were considered drugs for dying patients or cancer patients, and a lot of doctors would not prescribe them for common pain ailments.
Yeah.
And so they tried very successfully to change the prevailing attitudes towards opioid prescribing in general, which also opened the field up to other competing opioids.
And like Percocet and whatnot.
Right. There's Duragesic patches and all that.
Yeah, you mean like it opened the field up for more for the development,
for other drug companies to introduce
different forms of
opioids.
Yeah.
So it's obviously, since that medication was very successful, many competitors jumped into the field, and of course lots of money was made. But it's really just disturbing that internally Purdue was well aware that the drug did not last as long as they said. They were claiming it only had to be dosed twice a day, once every 12 hours, but it did not last that long. They seemed particularly resistant to admitting any wrongdoing at all.
That's so crazy.
In fact, they engaged throughout, I mean, even until very recently, with victim blaming. The leadership of Purdue Pharma, called the patients who were addicted to their own product criminal abusers. That these were patients that were just
Drug
addicts that were predisposed to addiction, and that it had nothing whatsoever to do with their product. Even with presented with any evidence to the contrary,
They weren't having it?
They were not having it. And really, in their case in particular, it was this being a privately held company that was literally owned by just one family. They were just very much preserving their own self-interests.
Yeah.
Their own enormous wealth.
Their own profit.
Was their own really only concern. And even now that they've been forced by courts to pay settlements, they refuse to explicitly admit any wrongdoing.
What do you think is the most effective way to potentially reshape somebody's view on drugs that might be harmful or scientifically inaccurate?
That's a great question. I think you don't see a lot of positive portrayals of drug users at all in film or television, and that reaches probably in the present time more people than books as far as popular culture. I know maybe with other marginalized groups, over time media portrayals have increased, and I think that this has led to more acceptance, LGBT people or trans community, etc.
You think can you
So I guess the point is, as media portrayals of certain previously marginalized groups have become more positive, which I think has led to more widespread acceptance. This really hasn't happened yet, I think, with drug use in particular, particularly recreational drug use. So that if that were to happen, that may lead to some shifting attitudes in the general consensus.
What do you think is an important thing to keep in mind as people's perspective on drugs changes in?
If that were to happen, I would just be concerned that people might use drugs without understanding fully possible consequences, or might not understand that they shouldn't mix certain medications, like with alcohol, for example, or might not know about appropriate dosing, So just as long as the knowledge is there, then that's one thing. But if people were to maybe make uninformed decisions just because they saw something portrayed a certain way in the media, that probably not be the greatest thing.
Yeah, and I think that that's probably already been done a bunch of times. I mean, when you talk about like harmful behaviors as they're portrayed in media, like Carl Hart talks about this, but like with The Sopranos, how like it's almost like even though Tony is killing people and is blatantly racist, like it's almost as if The Sopranos portrays Christopher's drug habit as more of a problem, or more harmful, or more problematic than Tony's day-to-day actions. So what I think is interesting to move forward, or something that I guess I want to keep asking people, is like, how do we neutralize, so that there's no, like, because in the media, a lot of it's, a white narrative, and while, certain marginalized groups are being pushed forward more into the spotlight, I think some drugs also will be pushed more into the spotlight, which will push other drugs more into the shadows. And so by like mushrooms becoming super, in the spotlight, and people think that it's, whether or not people have had positive or negative experiences from it. However, people's opinions on mushrooms will start to change, but their opinions on harder drugs may start to just become more saturated of what they already are. Like, mushrooms good, and it makes crack cocaine seem even worse,
right.
And do you see that becoming an issue, or?
I think that probably yes, and that if attitudes towards certain specific drugs do change, that probably not necessarily spill over into all illicit drugs, if you will. I think some substances certainly have come a lot further in the public mind as being acceptable. So I think it does seem plausible that if certain classes of drugs, like psychedelics, et cetera, that have become somewhat more acceptable, if you will, in the mainstream, that by comparison, opioids very well may seem even worse, if that's the right term, which might lead to people who are using opioids to feel even more marginalized if other kinds of recreational drugs are seen suddenly as more acceptable.
Would you argue that it's maybe a good idea to have some kind of story that doesn't over-exaggerate the positive effects of opioids, but maybe paints a more accurate truth, or some kind of media form that doesn't what's it called, like smudge or besmirch any kind of opioid use or any kind of opioid users, like something that's more truthful about it, or even a positive experience, where they have clinics in Switzerland where there's patients that take heroin and are monitored and lead really great, productive lives, and their amount isn't considered to be a bad. The fact that they take heroin is not considered to be a bad thing.
Right. I think, I can hardly think of a really positive or even neutral portrayal in the media of recreational opioid use. It's almost entirely negative, and I mean, certainly there are negatives, but the fact that it is at least possible to use opioids safely in such a way is almost never seen in the media. So I think that it could be probably something as time has gone. I mean, opioid use is so widespread that there's always more than one perspective on everything. Not everyone's experience is the same. Mm-hmm. So while many people, have had very bad experiences, it's not the universal norm. It doesn't have to be.
Definitely. And same thing with psychedelics. Like, they aren't going to be the saving grace for everybody, like, weed isn't going to affect everybody the same. It would be crazy to argue that psychedelics are going to affect everybody the same. And by the same, I think on the other side of the token, we have to argue also, like, people are able to have really positive experiences on drugs that are considered bad. People are able to have potentially very meaningful and significant experiences on, like, cocaine or an opioid or an amphetamine of sorts. And that's not to say that that's better than anything else, but I think I don't know, like, the concept of having a positive experience shouldn't just be limited to the drugs that we deem quote positive.
I think that's a very good point. Certainly, like we were saying, certain drugs are almost never portrayed in a positive light whatsoever, and it's not, I think, quite so black and white as that, where certain drugs are always bad and certain drugs are always good. Mm-hmm. As with most things, there's definitely more nuance.
Definitely. Okay, I think my last question for you is, what has changed your mind the most on drugs?
Probably, honestly, just educating myself just through extensive reading. I couldn't say that the media narrative that's reached me or even the news media has really done much to change mine or probably anyone's mind about the negative impacts of drugs, especially opioids, etc. It's really, and I realize that not everyone it does this, but just extensive reading has helped me to understand that it's not such a black and white issue as it's often portrayed, that certain drugs are good, certain drugs are bad, that everyone has a bad experience with drugs like heroin.
Or that everyone has a positive experience with drugs like psilocybin.
Right, and there's good and bad to be found in all, and I think education is a key to just realizing that everything that you see in the media is not necessarily the entire story.
Yeah. Okay, I'm gonna ask you one more question. This one can be off the record. I can cut it off if you want me to. But if there's anything on that list that I had that you would want to try, or I guess quote on your bucket list of life, are there any on that would resonate with you in that way, or no?
Absolutely. I would say after reading maybe in particular Michael Pollan's How to Change Your Mind, psychedelics like psilocybin in particular, when reading about how people describe the experiences they had is extremely meaningful and profound. With some saying it was as significant to them as the birth of their child, for example. I would definitely, after learning more about it, be much more open to trying psychedelics in a controlled setting, especially maybe like just setting of a study, for example. Definitely much more than before. So out of all of them, I would definitely be the most open to psychedelics.
You think like mushrooms and LSD, you mean?
I also asked Aaron what his thoughts were on MDMA.
About MDMA sounded slightly less appealing than using the others, but certainly as a class, psychedelics are doing amazing.
Cool. Well, for the record, also, while we're being out of the closet about these things, I can, to that, say that psilocybin
has been like potentially one of the most profound teachers and healers on uncovering so many layers